Hi everyone, this is part 2 of my Could Your Piriformis Syndrome Be Coming from Your Low Back series. And this is another approach of looking at a different low back cause that could relate to a piriformis syndrome type presentation. So quick overview, piriformis syndrome is pain in kind of the middle of your glute here. It usually feels dull and achy. Sometimes there could be some numbness and tingling that people also experience, especially when they're sitting down. And it's basically just that like unremitting mid-glute pain that you feel frequently either with activity or with like physical activity or activities of daily living or getting up from sleeping in the morning. So we're going to talk about what happens when the cause is the low back instead of the piriformis. Oftentimes people who are given a diagnosis of piriformis syndrome assume that the muscle is just really tight and either it's painful because the muscle's so tight or it's painful because the muscle's so tight around the nerve that runs under it. But a lot of times people will try, soft tissue massage, stretching, lots of different therapies to target the muscle and will still have pain. So this video is for that kind of person. So if you do have that kind of pain, and it hasn't gone away with those things, then it could be either a low back disc referral, or it could be a actual nerve-based issue that doesn't involve a disc. We have made another video about the disc one, so that one is addressed in the other video. But if you have just a primary nerve issue, there's no disc involved, but it's still coming from your low back and traveling down into that nerve, because those nerves that go under the piriformis, they come straight from the low back. They come just like this. I'll give you a little demo right quick. They come out of the spine and they go back down here just like this here. And they can sometimes get tightened or compressed, kind of like a tourniquet around the nerve with certain movements. So that's why sometimes you'll feel this in certain positions or certain movements and you won't feel it with others. Some people just feel it all the time because their nerve is like super inflamed. And we're going to do something for if the nerve's compressed. So if the nerve is compressed, we're going to go ahead and open the low back by doing some opening type movements. So my favorite opening movement is a happy baby. We're going to go on the back. We're going to put the feet up like this, grab the feet and ankles down, and just kind of hang out here. Hang out here for about 2 to 3 minutes. Or if that's too long, give it 30 seconds, rest, then come back up and do that 4 or 5 times. And then check and see if your glute feels any better after that. If it does, then you've got a little bit of a nerve issue and you should be doing nerve-based rehab for that area. And if you have more questions about nerve-based rehab for that area, go ahead and reach out to me. My info's in the description below, or subscribe or send me a comment. There's a lot of different ways to kind of figure out what the next best step is, but if that helps you, that tells you that the piriformis is not the primary issue, it's just a secondary symptom, and the main issue is the nerve that runs under it that's irritated. So give me a subscribe if you want more information like this. Thank you guys and have a great day. I hope this helps.